Hello, this is Dr. from Korea Tooth Bank. Today I will introduce clinical application of AutoBT BMP, which is a recombinant human bone morphogenic protein loaded onto dentin powder. This technology has been certified as a new medical technology from Korea Ministry of Health and Welfare and has been approved for its clinical safety and effectiveness. Unlike the conventional materials, which is mixing BMP to carrier materials just before the graft, AutoBT BMP is an integrated dentin coated with BMP. Consequently, it has the same appearance as the existing powder and block, and it's convenient to use as well. The main indication can be considered as old age, a medically compromised wound, non-healed wound, osteonecrosis, and etc., where bone regeneration capacity is significantly reduced or delayed. This is the dentin, which is strong endogenous BMP of its own. Please refer to Professor Kim's lecture number 13 and 14. Treat this dentin to expand the dentinal tubules. Loosen the collagen fibers to be exposed to the surface. And then BMP can be stored between the collagen fibers as well as enlarged dentinal tubules. Now, the dentin composite has three types of BMP. Two exogenous BMP colored in red and green, and one endogenous BMP colored in black after the graft, which may play the major role of osteoinduction. These are the related researches papers to get approval from Korea Ministry of Health and Welfare for clinical safety and effectiveness. Especially, it was a great honor that the histological feature of this dentin reinforced with BMP was selected as the cover art in the issue of Tissue Engineering on June 2020. Now we will go through the application of AutoBT BMP to a ridge split procedure on lower anterior alveolar ridges. The alveolar ridge has become a knife edge state due to the resorption of alveolar bone without any functional loadings for more than 5 years. The treatment plan was ridge split and expansion, immediate implant placement, and AutoBT BMP powder simultaneously. Reflect the flap to expose the thin alveolar ridges. A vertical incision must be placed on sound bone and undermine upward from sound bone here at the base to alveolar crest area to expose the bone being resolved easily. The central part of the knife edge also shows a defect due to the root rest, so it's not easy to expose and even split. Since the major part of the expansion is the labial cortical bone, which is subject to resorption, bone incision should be performed at the most lingual side. The crest is very thin and has a defect in the center, so use a small round bar with a diameter of 0.2 millimeter. Bone cut from the crest to half depth of planned implant length and cut half the cortical bone horizontally to achieve green stick fractures after the ridge split at the base. The defect looks big in the center, but I succeed in expanding the thin labial plate. The point of this procedure is that the labial cortical plate should be retained as thick as possible where marginal bone resorption should occur with dental implant in the future. For the implant prep, if guided drilling is performed with the high-speed bar first, the labial cortical plate will not be pushed or moved during the prep in the lower cortical bone to obtain implant stability, but also to prevent the expanded labial plate from fracture or a separation from the top of the prep bar. The implant is being placed well without any movement of the labial plate. You can check the position and space around the implant. Considering the increased alveolar bone width due to the rich split in implant, make a releasing plan by measuring the tension of the flap and the shallow depth of the labial vestibule. And then fill the AutoBT BMP dentin powder into the space around the implant in between the labial and the lingual plate. Even if it's not moldable, when it comes to the contact with the patient blood, dentin powder becomes sticky, so it is very convenient to use as shown in the pictures. And AutoBT BMP is dentin composite, that the appearance is the same as the existing dentin powder. There is no need to prefabricate prior to transplantation, like in conventional material. Since thin labial cortical bone is separated, there will be a restriction in blood supply. So dentin powder loaded with strong osteoinduction BMP is highly indicated. As you can see, due to the increased alveolar bone width, the gingival tension and the labial frenum in the shallow vestibule make tension-free suture more harder. Then, in addition to the periostal releasing incisions like this, we decide to apply the Dr. Um's incision, which was introduced in the last lecture, number 11. First, the usual periostal releasing incision is placed on the sound bone, and the appropriateness of the releasing amount is determined. Second, through and through incisions are applied from the labial mucosa to the periostal releasing incision to be a tunnel. Third, the penetration incision made in this way must be placed on the sound bone and should not be placed in the labial cortical plate where the split was performed. See the pictures. You can see the tunnels I'm making. After that, finish the sutures. You can leave it open for the apical horizontal incisions, also known as Dr. Um's incision. See here and leave it open. Okay, next. For your understanding, let me take this Um's incision one step further. As introduced in the last lecture number 11, leaving this incision open will help to reduce swelling and pain in the early post-op stage by drain functions. Around 10 weeks after, horizontal scar is formed, preventing the vertical muscular forces and deepening the shallow vestibule. Shall we look at the bone healing process? Two implants were expanded. Thin labial cortical plate has been changed with AutoBT BMP graft after 10 weeks. So the amount of alveolar rich width was significantly increased. You can figure it out how much the alveolar bone width increased in this picture. We will use CBCT and 3D images as today's messages. The labial area repaired with thin cortical bone and AutoBT BMP. After 5 months, area repaired began to form a distinct cortical bone. About 4 years later, you can see how it turned into a corticocancerous bone complex. You can double check through 3D images. Even in an 80 years old patient, new corticocancerous bone was obtained using AutoBT BMP powder from a very thin cortical bone plate. Therefore, it can be said that the AutoBT BMP has the ability of osteoinduction, osteoconduction, and bone remodeling capacity under physiologic occlusal forces. Okay, I'm not sure if I have explained this case well to the doctors and listeners. If you have any questions or comments, please leave a message and we'll prepare an answer and we'll upload it. Thank you for your kind attention. This has been Dr.